Okay, follow the bouncing ball here. Healthcare was a mess, cost way too much, sick people getting dropped by insurance companies, left to die and bankrupted and all that, sucking all the oxygen out of the economy. The obvious solution? Go to some kind of single-payer system or at least a universal, subsidized, heavily regulated private system, like all those other countries who pay half as much or less for better results. But that would never fly because the health plans are way too big, employ a lot of people, including a zillion lobbyists, so politically, forget it. We'll back off and cut a deal. So here's what that deal was supposed to be between us, the health plans, and the employers. First of all, we would all have to buy healthcare insurance. Second, the health plans would have to sell it to us. No cutting anyone out for things like pre-existing conditions. Third, the employers have to offer it to all their employees. This is all the employers, even the small ones, though they would be offered things like tax credits to help them out. And to keep everyone honest, there would be a public option, a government-offered plan. It would be inexpensive because it would pay people only 5% above Medicare rates, but the hospitals and doctors would have to take these payments anyway. The employers would have to offer minimum packages of essential benefits that would cover things like hospitalization, drug benefits, outpatient, mental health benefits, all the kinds of things you really need. If they didn't, we would still have lots of choice because there would be these insurance exchanges where we could take our money and our employer's money and go buy from lots of plans, including the public option. Sound like a plan? Great. But wait a minute. What's missing from this? How about the drug companies? Aren't there things we'd like them to do, like maybe negotiate prices with the government so the government can drive them down a little bit? Make it a little easier for generic companies to compete with them. How about re-importing cheap drugs from overseas? Well, it turns out we want everybody on board for this plan, so we'll make all these things illegal in the new laws, make it easier for them, not harder. Well, what about the health plans? Aren't there things we'd like them to do? Like, for instance, honor their contracts, stop refusing to pay for things that they promised to pay for, and stop tossing people out when they begin costing them too much money. Well, once again, we want everybody on board, so we may put things like this in the law, but we're going to make sure they don't have any real teeth. Then the details start getting sliced up and things start turning weird. The blue dogs in the House get the Commerce Committee to turn out a bill that says, well, actually, hospitals and doctors should not have to take the public option. It should be voluntary. They should be paid market rates, that is, what they're paid now. So the savings go out the window. The public option in this version is not particularly cheaper than the private plans. And anyway, employers with less than a $500,000 payroll, which is, by the way, 87% of all the employers in the nation, would be exempt. They wouldn't have to provide any health care insurance at all. Of course, the employees would still have to buy it for themselves, though, or they'd pay a big fine. Of course, they could buy the no longer particularly cheap public option. But over in the Senate, the Finance Committee lets it leak that it's probably dropping the employer mandate altogether and dropping the public option altogether. Employers wouldn't have to offer health plans at all, but the employees would have to buy them, whether anyone's offering them a decent plan or not. Democrat Ken Conrad on the committee says, nobody will go for a public option plan, so we'll try co-ops. This idea would consist of trying to start new not-for-profit insurance companies in every market in the country. Doctors and hospitals would not have to sign up with them. The co-ops would not have their rates tied to Medicare. They would have to pay market rates. Actually, they would have to pay more than market rates because the doctors, the hospitals in those markets, they're already signed up with the existing insurers and they have plenty of business already, thank you very much. So the new co-ops would have to bid premium rates to get providers to sign up, or they would have to rent them, again at a premium, from their competitors. No big deal though. If it's voluntary and paying market rates, the public option would have the same problem. High prices, not many providers, so not many customers. And then Ted Kennedy's committee turns out a bill that says, well, actually, employers are not really obliged to offer a minimum level of health care insurance. And yet the bill still keeps the requirement that employees must accept and pay for whatever health care plan their employer offers them, whether it seems an acceptable level of care at an acceptable price or not. So again, savings for the individual go out the window, and now the choice of health plans does too. So what's left? A real strong relationship between us and the health plans. They have to sell to us. They can't keep anyone out for pre-existing conditions or anything like that. But we have to buy, whether or not it turns out it's a good deal, whether or not it has the right kind of coverage that we need. So in this sort of situation, there's no real competition, there's no insurance reform, and there's no real driving down costs. If a so-called reform bill comes up with these elements, no employer mandate, strong individual mandate, market rates for everything, no real insurance reform, there is no reason to vote for it at all. It is worse than no bill. And that is about what we are facing right now.